Kendall was one of the first kids in Michigan and the first at our hospital to start DIACOMIT after it was allowed for compassionate use in the U.S. Now, Kendall is 18 years old and has been on DIACOMIT for about 8 years, and it has changed our day-to-day lives.
DIACOMIT is the only FDA-approved anti-seizure medication developed specifically to treat seizures associated with Dravet syndrome in children as young as 6 months, 15 pounds or more, and taking clobazam.
When Kendall started having seizures, Dravet syndrome wasn't a thing that many people, including doctors, knew about. Kendall had her first seizure in 2005 when she was around 2 months old. Our local hospital ran a bunch of tests, but they didn't find anything. They told us it was probably a virus, and of course, as a parent, I wanted to believe that. But 2 months later, she had another one. Our local hospital referred us to a neurologist at a different hospital, which is where we basically lived during her first year. We'd come home just to go back again. It was scary and frustrating to not have a diagnosis. We tried several medications that didn't work. Eventually, we did genetic testing to find some answers. It's amazing to see how far research has come in the last 18 years, and we're happy that families today have more resources to understand what their child is going through. But for our family, it was definitely a difficult journey. Before DIACOMIT, when Kendall was having more frequent seizures, we wouldn't travel. I felt like we couldn't leave her alone, and she was constantly missing school. Something like getting excited about the Halloween parade, anything that got her heart rate up, was a trigger. After DIACOMIT, she has had a significant reduction in seizures. During the first 2 weeks, she did experience some side effects, but after her neurologist made dose changes to her other medications, we found the right combination for her.
There are also risks for use of DIACOMIT. The most common side effects are sleepiness, decreased appetite, agitation, impaired coordination, decreased weight, decreased muscle tone, nausea, tremor, slurred speech, and trouble speaking.
We've continued to see positive results with DIACOMIT over several years. She's had so few seizures that I worry less about unexpected hospital visits. We can take Kendall to see her older brother play sports, or she can stay home with him while I get a haircut, things that I would not have done before. Our journey would have been very different without the amazing nurse who helped us get DIACOMIT through the Compassionate Use Program. We're so grateful that DIACOMIT was FDA approved in 2018. That has helped us overcome so many of the access hurdles we faced when we first started. And now that it's officially approved, there are patient assistance programs to help families access and afford DIACOMIT. Talk to your child's doctor about DIACOMIT because for children with Dravet syndrome, seizure relief is possible.
Indication: DIACOMIT stiripentol is indicated for the treatment of seizures associated with Dravet syndrome in patients taking clobazam who are 6 months of age and older and weighing 7 kilograms or more. There are no clinical data to support the use of DIACOMIT as monotherapy in Dravet syndrome. Important safety information. Contraindications. No contraindications are listed. Warnings and precautions. Somnolence. DIACOMIT can cause somnolence. Monitor patients for somnolence, particularly when DIACOMIT is used concomitantly with other CNS depressants or clobazam, which is also known to cause somnolence. Decreased appetite and decreased weight. DIACOMIT can cause decreases in appetite and weight. The growth and weight of pediatric patients treated with DIACOMIT should be carefully monitored. Neutropenia and thrombocytopenia. DIACOMIT can cause significant declines in neutrophil and platelet counts. Hematologic testing should be obtained prior to starting treatment with DIACOMIT and then every 6 months. Withdrawal symptoms. As with most anti-epileptic drugs, or AEDs, DIACOMIT should be gradually withdrawn to minimize the risk of increased seizure frequency and status epilepticus. Risks in patients with phenylketonuria or PKU. DIACOMIT for oral suspension contains phenylalanine, which can be harmful to patients with PKU. Before prescribing DIACOMIT for oral suspension to a patient with PKU, consider the total daily intake of phenylalanine from all sources, including DIACOMIT for oral suspension. DIACOMIT capsules do not contain phenylalanine. Suicidal behavior and ideation. AEDs, including DIACOMIT, increase the risk of suicidal thoughts or behavior. Patients treated with any AED for any indication should be monitored for the emergence or worsening of depression, suicidal thoughts or behavior, and/or any unusual changes in mood or behavior. Adverse reactions. The most common adverse reactions that occurred in at least 10% of DIACOMIT-treated patients and more frequently than on placebo were somnolence, decreased appetite, agitation, ataxia, decreased weight, hypotonia, nausea, tremor, dysarthria, and insomnia. Pregnancy. There are no adequate data on the developmental risks associated with the use of DIACOMIT in pregnant women. Based on animal data, DIACOMIT may cause fetal harm. There is a pregnancy exposure registry that monitors pregnancy outcomes in women exposed to AEDs such as DIACOMIT during pregnancy. Physicians are advised to recommend that pregnant patients taking DIACOMIT enroll in the North American Anti-Epileptic Drug (NAAED) Pregnancy Registry. Information is available at www.aedpregnancyregistry.org. This can be done by calling the toll-free number 1-888-233-2334 and must be done by patients themselves or their caregiver. To report suspected adverse reactions, contact Biocodex at 1-866-330-3050 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please see full DIACOMIT prescribing information at diacomit.com.